Okay, now you know, or you have a rough idea anyway, what's going to be on the show. It's something that concerns us all. It's a social responsibility that applies to our whole country.
It's drug addiction. And I'm going to reserve my comments until we've had more people on the show talking about drug addiction. What I want to say though, Amina, first up, is that I think we need to recognize, we need to blame the problem and not the person with the problem.
I have to tell you, we've had hammer and tongs offset on this one, yes. But she's right, it is a symptom. It's a symptom of our culture, it's a symptom of our society. Why does it happen? It happens with affluent people, it happens with poorer people as well. So what's the commonality in all of this? Let's find out.
Pakistan has been a major exporter of heroin since the 1980s. Drug abuse is a major issue in the country. According to statistics from 1993, there were just over 3 million drug users in Pakistan. More recent statistics put the number of drug users in Pakistan between 3 to 5 million. The statistics relating to drug use are outdated for the most part. Pakistan's drug laws call for a 5-year term in prison. However, the implementation of this law is still very weak.
We're going to talk today about drug addiction, or addiction in general, not necessarily drugs, but substance addiction, I think would be a better way of putting it.
We've got on our show today Dr. Sadaqat. He's an addictions psychiatrist. He works with an organization called WillingWays.
Come on the set, Dr. Sadaqat. Great to have you with us on the First Blast. So what is addiction? Define addiction. What is it?
Basically, depending on something, some substance, person, or activity, which is not dependable, but you start depending on it.
It's a disease?
Yeah.
It's not generally, addiction is not considered a disease, but if you can shed some light on that.
You know, it is quite obvious that a lot of pain, hurt, anger, and damages are coming out of this activity sometimes. And it is a matter of fact that all people who use drugs do not ultimately cross that line and become addicted to the drug, but there are about 10–15% people who ultimately cross that line and become addicted to a person, a substance, or relationship, or an activity which becomes disastrous for themselves and their family. So it is a genuine disease. And when it comes to substances or substance addiction, then definitely it is a physiological, biological disease. It starts in the biology of the person.
So
it
you're
starts
saying
in
that a lot of people turn towards this in a time of distress?
People don't turn to drugs in times of distress necessarily. They turn to drugs for recreation. It's mostly the happy times. It is the dinner time, it is the party time, it is the occasion which warrants somebody to use drugs and alcohol and other things. And it is not necessarily the hurt or pain or sadness or depression which leads ultimately to use of drugs. It is not a matter of will. It is something to do with the metabolic system of the body. It is the body of certain people which is vulnerable, and it is a defect of the body and
more
not
so
the
than
defect
others.
of the mind. So the disease starts in the body. And it then leads to the psychology and sociology and spirituality.
So you're saying that your body is predisposed, some bodies are predisposed
some people have a predisposed, vulnerable bodies.
What is the first reaction that people have?
You see, the person suffering from addiction or alcoholism, first of all, he is going through denial. And then family gets this denial too, because it is too overwhelming to accept that a family member as an addict. So the family goes into denial. And as they say, the fish discovers water lost. So the person suffering from this addiction discovers last that he is suffering from a real problem.
The drugs that are sort of used
and
in
abused.
Pakistan are abused in
and
Pakistan.
abused.
Basically, there are 4 kinds of drugs which are used all over the world. There are downers like alcohol and tranquilizers. There are uppers like caffeine, amphetamine, and cocaine. Then there are narcotics. You are aware what narcotics are. And then there are mind benders like marijuana, PSP, and there are other mind benders.
LSD.
They used to be LSD.
So crack, LSD, ecstasy, where do they fall in all of this for the parents out there?
You should be talking to your children before the age of 7.